All right, this is our psychology disorder project. It's by me and Mallory Walker. Yep. Okay, so body dysmorphic disorder is a type of chronic mental illness which causes you to constantly be thinking about a flaw with your physical appearance. These are usually made up flaws that the person makes up, or it's not even, it's really just imagined and not even real. But they think it's real and that it takes over their entire life, so that's basically what they're just obsessed with whatever is wrong with them, but it's really not even there. Is and you don't want to be seen by anyone, so you just stay in your house the entire day and don't even go out and buy. It's just a struggle for these type of people to go out and even buy their regular groceries or anything like that. Body dysmorphic disorder was first called dimorphophobia. It was first included in the DSM-3 as a type of somatoform disorder, which means that it includes symptoms that are unexplainable by any other medical condition. In 1987, it was renamed body dysmorphic disorder. It has many similarities with OCD. Body dysmorphic disorder is classified as a pseudomorphic disorder, so the delusional imperfections these people see are either imagined or non-existent. The most common defects have something to do with skin complexion, skin color, balding, head size, acne, and nose shape. These patients usually see something wrong with their face or head, but they can have a problem with any area of their body or just have entire body itself. The patient is usually preoccupied with these defects for more than 3 hours a day. They do not want anyone to see them because they believe they are so ugly that they are saving people from seeing them. So they just stay inside the entire day and they don't have a life or anything because they don't want people to see these imperfections that aren't even real. It is to a point where the patient may feel unlovable and have fears of rejection and very, very low self-esteem. The patient will go to extensive lengths to hide their defects by putting on so much makeup it could take up to 3 hours to apply. Constantly checking in mirrors to see if it's noticeable. Wear clothes to hide the defect or emphasize a different part of their body. Skin picking, eating a restricted diet, or even plastic surgery are some things that these people go to so that they feel as if they can go outside and feel better about themselves. There are not really any known causes of body dysmorphic disorder, but it may result from a combination of causes. Brain chemical differences could be one. There is evidence that shows that neurotransmitters, which are naturally occurring brain chemicals linked to a mood, can be a factor in body dysmorphic disorder. There could also be structural brain differences, which would mean that body dysmorphic disorder patients have areas of their brain that might not have developed properly, which cause them to imagine themselves differently. Another cause might be genetics. Studies show that body dysmorphic disorder is more commonly seen in patients who have a biological family member who has this condition. There is also the environment the patient is exposed to. If the patient has been exposed to an environment that involves negative experiences about their body image, they could be at higher risk for this disease. People who have personality traits such as perfectionism, introvertism, or shyness, neuroticism, sensitive to rejection or criticism, unassertiveness, avoidant personality, schizoid personality, social phobia, or social anxiety disorder are more susceptible to body dysmorphic disorder. These characteristics can result in very low self-esteem and self-worth, causing the patient to feel that there must be something wrong with them, which results in the image deformity. Some famous people with this disease include Michael Jackson. Michael Jackson had over 30 plastic surgeries and never being satisfied with his face. He believed he had body dysmorphic disorder. He was comfortable with himself, always trying to hide his face and wearing a lot of makeup. Even Marilyn Monroe suffered from body dysmorphic disorder. Her stylist believed that she had this disorder. She was constantly looking in mirrors and obsessed with her face, always wanting to examine and change her face. At public events, she always felt like she could never live up to people's expectations of her, which brought her self-esteem down. She struggled with her image because her whole career was built on it, and if people did not like her image, she feared they would stop liking her, which gave her the obsession with changing her face to make it better. Heidi Montag, who was in the show The Hills, has had 10 cosmetic surgeries in one day. It is believed that she has this disorder, but we really haven't got a for sure diagnosis yet. But most people have believed that she has this disorder and is suffering from it also. And then we come to our case study, which is about a 30-year-old woman named Jill. She really believes that she is ugly and that people constantly laugh and make fun of her. She says that her biggest wish in life is to be, quote, invisible so that no one can see how ugly I am. My biggest fear in life is that people are laughing at me thinking I'm ugly, end quote. She has been preoccupied with her ugliness since she has been age 12. When she was 12, she became obsessed with her nose, saying it was too big and shiny. She went from being a popular girl who got straight A's to being socially withdrawn and unable to concentrate in school, which resulted in her grades dropping to D's and F's. When she was 18, she dropped out of school. She developed further problems with her face and hair until she was spending the whole day focused on her defects. She was frequently checking her appearance in mirrors to see if her defects were noticeable. Her makeup took hours to apply, and no matter what she does, she feels people are taking in special notes of her. From this point, her life has just spiraled down, and she has become housebound. The DSM-4 gave 3 main criteria for body dysmorphic disorder, which are preoccupation with an imaginary defect in appearance, which would be where she started with her nose and continued with her face and hair. Another one is the preoccupation causes clinical significant distress or impairment in social, occupational, or other important areas of functioning. She stopped being able to focus in school and she had to drop out at age 18. She could not keep a job. And lastly, the preoccupation is not better accounted for by another mental disorder, and she does not have any other disorders before this, and there was no warning signs. She was just a normal girl. Symptoms that must be present for a person to have body dysmorphic disorder are preoccupation with an imaginary defect in appearance. If a slight physical anomaly is present, the person's concern is markedly excessive. The preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The preoccupation is not better accounted for by another mental disorder.